Howdy, folks. I'm Bob Schrupp, physical therapist.
Brad Heineck, physical therapist.
Together, we're the most famous physical therapists on the internet.
In our opinion, of course, Bob.
Today, we're going to show you how to do upper neck stretches and exercises. So, how does the upper neck become tight? Well, here's your head, here's your neck, and quite often people lean forward like this when they're looking at their cell phone or looking at their laptop or looking at their computer. So look at this. If I'm forward, I'm going to go into Brad's orientation.
There you go.
So if my head's forward like this part's going to get stretched out, but this part is actually, the muscles are going to shorten.
Yeah, right underneath the skull there.
And after a while, that actually can make it difficult to even straighten back up again.
Right, so you end up permanently like this. I mean, it could happen, but if you do these stretches, it's going to get you back up where you need to be.
Right, and every inch forward puts 10 more pounds of stress on your neck.
Yeah, because that weight is pulling down. And it depends on how heavy your head is.
Right.
But whatever, it's a lot more. It's just plain matter of physics and leverage.
Right. So you want to stretch these neck muscles out, and they can also put stress on a nerve there and send pain and headaches into your head. So, in fact, they call it the ram's horn. If you look at a ram's horn, it goes curls. Yeah, and that's where the pain is often felt, in this area right here.
Yeah, my brother-in-law had it, and he referred to it after a car accident, actually, if it was a full wrap. That meant it came up around all the way to the eyes.
Right.
And he said, I got a full wrap headache now. And
not good.
Yeah.
All right, let's show you some of the exercises you can do. We're going to start off with the chin tuck, which, why don't we show it seated first?
Sure.
So basically, it's a good, not only a stretch, but a good reminder where your head should be.
Right.
So you're going to take your chin.
And actually, before that, Bob, make sure, like, if you're sitting like this, get your bottom back, get your trunk and shoulders in proper alignment first.
Yep. And then you're going to go ahead and just back up the head, basically. You're not going to tilt up, and you're not going to tilt down. You're going to just go straight back. For some of you, there may not be much motion there.
Right.
That's the problem. Tight. So get what you can get. But you could do these throughout the day. Certainly, we want you to do 3 sets of 10 to start off with, maybe.
Sure.
But throughout the day, maybe do a set of 10.
Are we going to show any overpressure? Or?
Yes.
Okay.
You want to do that already? Or do you want to show? Maybe we'll show this if you're having trouble.
Okay, sure.
Yeah, why don't we show overpressure? You can actually, what Brad is referring to, you can actually take a couple of fingers like this and push on your chin, or you can take the crooks of your thumb and push back like this. Now, there's a couple ways you can do this. You can just start pressure on, pressure off, pressure on, pressure off, or you can actually hold it for like a minute.
Sure.
Especially if you're having a headache. Quite often that feels a lot better.
Right. If you do this and you do get some unusual pain, or the pain gets worse into the head for whatever reason, then you would stop. You only do this if it feels like a good stretch, maybe some pain that hurts so good.
Feels good pain.
Yeah.
Right.
And don't get real aggressive on this right away. This is a gentle push.
Now, Brad, if you are having trouble doing this, and a lot of people do,
what do you want me to do with this?
I don't know. Get it out of the way. So you can take a rolled towel and you can lie on it, and you probably want to be on a fairly firm surface. But I suppose if you have a big enough towel, a bed would work even. So it's going to make it easier to chin tuck when you're in this position with the rolled towel underneath the back of your head.
And sometimes if you just lie there and relax, you're going to get a certain degree of stretch because of it. Yep.
Good point. Or you could also do the overpressure here. But I can start getting you on your way to stretching that upper neck.
I've always told my patients, and it seemed to work good for a verbal cue, I'd say, see if you can touch the back of your neck to the bed or the floor, wherever you're on, and then people get the proper motion. That would
probably be a smaller roll.
Yeah, or even if you don't use the roll, because eventually you get without the roll.
Exactly. You can start to go like this.
Yep.
All right, the final thing we want to do is that those tissues, those muscles, can get scarred down. They can get adhesed down. And what Brad's going to demonstrate now is how you can do some self-massage to the area.
So I'm going to take my mic off, so if I talk, people will be glad to know they can't hear me. So
So I'm going to talk now. The first thing he's going to do is circular motion, and it's right where the skull meets the neck. So right along the skull line, you'll be able to feel it, and you can go a little bit lower than that. That's usually where the muscles are tight. But Brad's doing a good job of doing circular massage. He said it just cracked. And then you can also do a splaying massage, where you bring your fingers together and splay them out, take them out to the side of your head. You do this along with the chin tucks. And again, you could do this throughout the day. If you start feeling a headache come on, hit it right away with this, and that will help. There's more that you could do, but we're going to keep this simple and start with simple is easier and simple is often better. So we'll stick with that. Check out the rest of our program. It's called Bob and Brad's Stretch and More program.
stretch more?
Stretch and More.
Oh, stretch and more, yeah. Does that mean more what?
Exercises, whatever. We wanted to include everything.
That's right.
Thanks for watching.